Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
Welcome to another edition of the Lunch and Learn with Dr. Barry. I'm your host. Today we bring you episode 61. And like always, if you want my show notes, please head over to drpierresblog.com/LLP061 or head over to lunchlearnpod.com where you can get a chance to listen to the episode at the website or your favorite podcast platform that you like to listen to your podcast from. Today we're going to be talking about why your physician is cheating on you. We're going to be talking about who's to blame and what you can do about it. And first and foremost, I want to thank all of those listeners from last week's episode who sent me messages, comments, liked, shared. Again, it's much appreciated when you guys kind of show that you listen to the episode, that you actually listen to the episode. And we had an amazing guest, Maria Davis Pierre, who's the CEO of autismandblack.org. And we talked about autism in the black community. Most importantly, we talked about what are we doing for the parents and caretakers of those with autism and why it's so important. Make sure we don't lose focus on them. But for today's episode, we're going to get serious. We're going to be talking about physician suicide. We're going to be talking about physician burnout. And we're going to be talking about all these other different factors that's really aiding in the fact that your physician is cheating on you, right? So stay tuned for another amazing episode. And like always, if you love it, like it, share it, throw the comments on there. If you have Apple Podcasts, go ahead and throw me a 5-star review. I can't have too many of those, right? So let's get ready for another amazing episode today. So this week, again, we're going to be diving into the question, is your doctor cheating on you? And I'm sorry to break the news. I'm going to answer this question pretty quickly in the episode. The answer is yes. And the reason why you're going to stay and listen to this episode because you want to know why your doctor's cheating on you, right? Because I think that's more important, right? A lot of us need that closure and a lot of us need that answer, right? And I'm going to give you the answers today why your doctor's cheating on you and why it's so important that, and again, I want to tell you right now, it is not your fault. If you're listening, if you're driving, you're listening to this while you're at home, while you're at work, I just want to let you know it is not your fault your doctor's cheating on you. These are things that are happening way before your doctor even saw you in that office or saw you in that clinic. But unfortunately, because of it, your doctor's cheating on you, right? So what am I talking about, right? Like, for example, I want to bring us back to the beginning. Like, why did your doctor become a physician in the first place, right? Like, what was his main driver goal, right? I've been through a lot of medical school interviews. I've had a lot of medical school mentees. And when I ask them why do they want to be a doctor, usually in one way, shape, or form, they say they want to care for others, right? Like, that's a big driver that goes through a lot of personal statement essays that I've read that, it's about caring, it's about caring, it's about caring. And I think that's true, right? I think a lot of us generally like caring for others and like to be able to make that difference, right? I think that's the most important thing, right? When we say caring for others, it's not necessarily like the fact that they directly want to care for others, right? They are extremely happy and proud of the fact that they are able to make a difference in someone else's life, right? So I think those two things are some of the biggest reasons why people become physicians and why when they were pre-medical students, why they were pre-med in elementary school, right? They just knew, right? Because that feeling of helping someone and feeling of making a difference in someone's life was such a big factor for them, right? That they couldn't think of another career choice that would have gave them that same satisfaction, right? And I think last but not least, right? And again, this is a very short reasons, right? There's plenty of reasons, but I think the main one, right, is the money and the prestige, right? And I know money, for some reason, especially when we're talking about doctors, right, is this evil term that we don't like talking about. I'm not sure why, but I could tell you money and prestige is a big reason why a lot of my friends became physicians in the first place, right? And I want you to kind of think about those themes, right? I talked about caring for others. I talk about being able to make a difference. I talk about money. I talk about prestige. And you're going to start maybe, being able to build up some reasons right on the top of your head of why your doctor is cheating on you, right? Like what's happening, right? That's making these doctors less interested in the field of medicine, right? So again, I say cheating on you. A lot of times I'm really addressing the hyperbolous fact that your doctor does not want to be a doctor anymore, right? Again, your doctor is working in a hospital, working in a clinic, working at the school, teaching. Like your doctor's doing a lot of things, but they're day in and day out, they're beginning to ask themselves the question more and more, like, do I want to keep on doing this? And unfortunately, they're doing this at a rate that we unfortunately cannot keep up, right? Like we do not have enough medical students, medical schools, residencies in America, right, to keep up with the demand of people wanting to leave the profession, right, or leaving the profession unwillingly, right, and unfortunately, right. Now I'm going to talk about that later on in the podcast today. So I think, first and foremost, right, like I think the big thing, right, and I think we've been kind of dancing around the term, right, physician burnout, right, like that is a huge term. When you get a chance, of course, after you're done listening to the podcast episode, I want you to just Google those two words, physician burnout, and see how many articles are coming out day in on day out, month after month on the same topic, right? Because it's something that's playing a huge factor in the fact that your doctor's leaving you, right? Like it's playing a huge factor in the fact that you're having trouble finding a doctor, right? It's playing a huge factor in the reason why your healthcare costs so much, right? Because physician burnout is real and it is becoming much more apparent. And I think in the past where we tried to downplay it, now we don't have that option no more, right? Because the numbers are astounding, right? Unfortunately, right? So just a couple of things, right? Especially when we talk about physician burnout, what do you mean, right? We're talking about a physician who is burnt out, right? Tends to be much more stress placed upon them, right? A physician who is burnt out tends to be much more depressed as well, right? And these are some startling numbers, right? I've said this on the podcast and even on the blog post in the past. 300 to 400 physicians commit suicide every year. Now, I want you to kind of think about that. Like, I went to Nova Southeastern University, College of Osteopathic Medicine. Our class was about 200, and we had, especially among medical schools, one of the largest medical school classes, right? Our class was 200, but every year I'm losing about 2 times as much of my entire class to suicide. And these are people in what you would consider the peak of career pinnacles. Like again, they're the physicians. They're the quote unquote top of the food chain when it comes to healthcare, quote unquote. And I really have to stress that because they're not, right? But of course, in the lamest term, you think again for a lot of people growing up, like yes, I can't wait to be a doctor, right? Because all of those prestige that comes with it, right? And unfortunately, it's just not there no more. Also, some telling facts. Female physicians are 130% higher chance to commit suicide than the regular population of females, right? So if you're a female physician, you have a 130% higher chance of committing suicide. If you're a male physician, you actually have a 40% higher chance of committing suicide than just other regular males, right? So again, this is something that when we talk about physician burnout, we're not just talking about a person who's just like tired, like, you know what, I'm done, I quit, right? A lot of these people are taking their life because they're so tired and they're so frustrated in a system that for many of us, right, many of us, especially if you're not aware of how long it takes to become a physician, right, let me just give you a quick breakdown. If everything works well, right, you have to do at least 4 years of undergrad, right? That's if you finish on time, right? 4 years of medical school, and right after you do medical school, you still have to choose your specialty, right? Like you still have to choose which type of physician you're gonna be, and that time frame can range from 3 years minimum to up to like 8 years, right? So I want you to again just quick math with us, right? 4 years undergrad, 4 years medical school, 3 to 8 years of a specialty, right? So we're looking at the bare minimum 11 years since you started undergrad that it takes you to become a physician, right? 11 years, right? And these are people who are dedicated 11 years of their life, and if they're like me, right, it's usually the best years ever, right? Like I remember, especially as a 21-year-old, what I was doing. I remember as a 25-year-old what I was doing. And you know what it was? It was studying for a test, right? Like those like two events, right, that are supposed to be important when you're growing up, right? 21, 25, right? I remember studying for tests, right? Like we give up a lot of people. I don't say we, a lot of people, right? Give up their 20s to become a physician, right? Like then we don't even remember what happened during our 20s, right? We got out of school, out of high school at 18, and next thing you know, we were getting out of medical school and residency, and we're about to be 30, right? Like, and that's if you went all the way through, no stops, no breaks. Most people, unfortunately, do not, right? So that's that's sad, right? Like that's again, if you want to feel bad for physicians, right? Like we can start there, right? That they're experiencing way too much stress and way too much pressure, right? Like I joke, but I say that physicians are one of the few careers that you have to be correct 100% of the time, right? Like imagine if you go to your lawyer, you pay your lawyer for his case, and you don't win, right? You can't go and say, hey, well, since you didn't win, I need my money back, right? No, you can't do that. But as a physician, right, because what we deal with is a life or death situation every single day, a bad decision, right, can cost someone's life, right? A bad decision could be the reason why you don't see grandma anymore, right? A bad decision is the reason why you don't see your mom anymore. A bad decision is the reason why you don't see your son or daughter anymore, right? So imagine having that that stress, right, thrown upon you every single day you go to work, right? 24/7, right? Like that's the stress, right? The stress level, pressure level that we sign up for in the beginning, right? And again, I always try to stress this to my medical students because sometimes I don't know if they really realize, like, hey, you know what? This is happening, right? Like this is what you're signing up for, right? I just want to make sure you understand what you're signing up for. And it's getting to the point, right? And again, I talked about physicians, right? But it's getting to the point where now we're talking about medical student burnout, right? Like, isn't that crazy? Like, again, these are people who, again, if you're like me, you wanted to be a doctor since you were in like elementary school, right? And you get to medical school and you don't even graduate medical school before you start feeling less optimistic, before you start feeling more jaded, more depressed about your decision for going to medical school, right? And these are studies, again, and I have notes in the show notes. I have links to some of these articles, right? That's scary and astounding, right? And I think as a patient, right, as a person who's listening to this episode right now, and you're wondering like, wow, that's crazy, right? But like, how does that like affect me, right? Like I'm gonna just give you something. Let's think about it, right? Like if you're having less physicians, right, less experienced physicians out in the workforce, you best believe quality is going to suffer, right? If you have less experienced physicians out in the workforce, you best believe safety is going to suffer, right? And I talk about physicians, right? This really stretches to most of my health professionals, right, including nurses, right? And again, I think nurses are somewhere where we kind of forget. Nurses have to deal with a lot of people, right? Especially, and shout out to my nurses who listen to the podcast, right? Nurses have to have a lot more patience, a lot more, because again, especially I'm a hospital medicine doctor. I may see my patient, in that morning time for a good 20, 30 minutes, and theoretically, I don't necessarily have to see them at all, right? That whole day, right? But my nurse who's there for 12 hours has to see them, almost every hour. Every time they hit the call bell, they got to see them, right? So they have to deal with them much more frequently and actively than I even need to, and I'm the physician, right? So the nurses get it too, right? But especially my physicians, right? Where, we're getting beat down, we're getting broken. And it's happening not just when you're a physician, right? But even we're starting to hit the medical students, right? And I think that one for me is more sad because I'm like, wow, we're getting the dream and that glow in a person's eye right out of there before they graduate medical school, right? Which is absolutely crazy to me, right? So again, you got to be concerned, right? You got to be concerned that if you're having less physicians out there, quality is going to suffer, right? You got to be concerned if you're having less physicians out there, safety is going to suffer, right? You have to be concerned, right, that if job turnover because your physician burnout is so high, it is increased, right? It's going to be associated with physicians making poor decisions, right? It's going to be associated with physicians, saying, hey, I'm about to leave out of here. I don't even care, right? So imagine, right, one of the tenets that you went into medicine for, right? Caring for others, making a difference, right? Imagine that being gone, right? And all you have left, right? All you have left is the money, right? It could be a very tenuous situation, right? Studies have shown that those who have higher risk for physician burnout are much more likely to be associated with job dissatisfaction. Of course, much more likely to have an intent to leave their job. So these are people who they can't wait. They're counting down the days till they get out their job, right? And I'm gonna turn the camera on me, right? I'm gonna turn the camera on me right now. I remember when I was at Bethesda Hospital, right? That was my old job. I was outpatient medicine. Loved my patients, but I absolutely hated that corporate structure and administration. I absolutely hated it, right? It was just something that I just could not stand to bear, because I was in a situation where I really felt like, what? Regardless of what I do, right? I had people who did not go to school as long as me telling me how to practice medicine, right? And it just irked my nerves to the fullest, right? So I can tell you, when you talk about job dissatisfaction, it was right there, right? Fortunately for me, I never let it, ooze down to the patients, right? My patients never felt that, right? I didn't even have an intent to leave my job, right? I was still going to stick around until, a better job came looking for me, right? Shout out to Wellington Regional Hospital. But again, that's what happens, right? You just become so dissatisfied. You hate going to work. You hate pulling up your car in the parking lot, right? All these things just continue to happen, right? And if physician burnout continues to become a thing, you best believe healthcare costs is going to suffer, right? Because if you're having less physicians out there to take care of that growing population, right, you're going to have a demand issue that's going to cause healthcare costs to shoot up off the roof, right? Because again, someone's got to take care of them, right? So now they're going to have to pay more and more people who may not be as qualified to kind of take care of this population, because they just don't have enough physicians to do so. And I've kind of already hinted, right? So again, what's the cause of this, right? Why is my doctor cheating on me, right? I'll honestly, right? These are some points. Again, I'll put this the show notes. I put this link in the show notes, right? Work hours, right? A lot of physicians, right, are being burnt out just by the sheer number of hours they're having to put in on the clock, right? Again, these are people who had to dedicate at least 11 years of their life, and now they're working a ridiculous amount of hours. Again, I remember as a resident, I was working on average, especially when I was on medicine service. I'm obviously, if you follow me, I'm a board certified internist, right? As a medicine, I used to do on average about 70, 80 hours, easy, right? I was oh yeah, I could do 70, to the point where when I would do an outpatient medicine rotation and I only have 40 hours, I felt like I wasn't doing anything, right? That's how much they ingrained that craziness of work hours, right? Where I was doing 70 to 80 hours, right? Getting paid pennies, right? 70 to 80 hours, right? As a resident, right? And I thought that was the norm, right? So imagine once you finish and you become an attending, and you're still working those crazy. And again, most of them aren't working at 70, 80 hours, but they're working pretty crazy from that standpoint, right? So again, that was something that definitely plays a role in this, reason why your doctor's cheating on you out here. The time spent at home doing work, right? I want y'all to really think about that, right? I've already talked about how physicians are spending a lot of time at work in general, right? They're just spending a lot more time at work. But imagine not only are you spending all that time at work, but then when you go home to your spouse, then when you go home to your kids, or then when you just go home to your fortress of solitude, you still got work to do, right? You still got paperwork you got to take care of, right? You still got charts you need to close, right? Imagine that, right? Imagine that happening once a week, or twice a week, or three, or every single day, right? You got something you got to bring home, and the reason why you bring it home is because you just don't want to be in that place anymore, right? Sometimes I'm guilty, right? Sometimes I will leave my job to finish notes here just because I don't want to be in that building anymore. Right? I'm like, let me get out of here, right? Let me get a fresh sense of air, and let me get back to my house, my kids. Let me get out of here for that, right? So the time spent at home just doing work becomes an issue. This work home conflict, right, where you don't necessarily know, like, hey, like, I got to do all of this stuff for work, but I got home stuff to take care of too, right? Like, I got personal commitments to take care of, and I can't even do so because I'm doing so much work over there, right? And again, that may fly cool for like the first month, the first 3 months, or even the first year, but after a while, you know what, that spouse is gonna be looking at you like, hey, now, like, yeah, I don't think we signed up for all of this, right? Like, you're never home, or when you are home, you're not here. Like, that's something to think about for sure. And this one kind of spoke to me, right? Like, this perceived powerlessness, right? Like, as a physician, right? Again, you've climbed up the ladder, right? You studied a test, right? You studied the organics, the physios, the chemistries, the biochems. You studied all of these courses, right? You know how to take care of patients, how to save patients' lives. And then you go and you have an administration telling you, hey, I need you to do it this way, right? A person who has no clinical background judgment whatsoever is telling you, hey, you should do it this way here, right? Or, hey, you know what, this patient has a stroke, and even though, you know what, they can't move their whole left side of their body, please make sure you put a cholesterol medication on their chart, right? Like, that's some of the things that happens like today, right? Like, again, I wish I was being hyperbolous, right? But that literally, again, I'm a hospital medicine doctor, so that happens to me all the time. Like, I have patients in the ICU, huge stroke, not moving, not doing anything. And I have someone in administrative saying, hey, you know what? This patient was diagnosed with a stroke, and they should have aspirin on their chart. Can you put aspirin on there? And when I say something like, oh, this patient like can't even open their eyes, right? Or this patient, can't even eat, right? Like, it's I'm sorry, but the rules are like, that's what happens, right? So it's a crazy thing that's happening in medicine now. And I think last but not least, you get this false sense of hope, right? And again, you've been striving to care for others since you were little. You've been striving to make a difference since you were little, right? You're also striving to get some money since you were little, right? But then you start realizing that, hey, you know what? As a physician, I ain't really getting all of this money that is being spent out here, right? As a physician, right, I'm not caring for others like I thought I would be, right? As a physician, you know what? I'm not making the difference that I thought I should be, right? Like, all of these things that you said, boom, I need to do this, and that, it ain't happening. Right, so all of these things just kind of hit you like over the head, like, and again, this usually doesn't hit you on the first day, right? Usually doesn't hit you on the first month, right? But over time and day after day, Monday through Friday, over and over again, that's when you start experiencing, right, like that guilt, right? And that's when you start breaking away, right? For those who may have been in a relationship, right, where you realize, you know what, it was time to get away from this other person, right? That's what's happening now, especially in healthcare, right? Especially with a lot of physicians, right? Like, they're feeling this gap, this void that needs to be filled, and right now medicine just isn't filling it anymore. So they're trying to leave, right? They're trying to cheat on you to get up out of there, right? So I want you to think about that. And like, who's affected, right? This may shock a lot of people, right? Like, younger physicians, right, are much more likely to have physician burnout than older physicians, right? Like, what does that mean? Like, I want y'all to think about that. Younger physicians are much more likely to say, you know what, this ain't for me, right? I'm getting up out of here, right? Than your older physicians, right? By older, the article described physicians older than 55, right? Which is absolutely crazy, right? Female physicians also are much more likely to be burnt out. And again, this isn't a shocker if you remember earlier in the podcast, I talked about how you have 130% higher chance to commit suicide, right, as a physician if you're a female, right? So again, of course, they're going to feel much more that undue stress that they would just feel in general, right? Those with children, right? Like, again, this is, again, I was like, oh, all right, when are they talking about me, right? Those with children are much more likely to experience that burnout, right? And that kind of points to the fact that, you know what, there's a lot of time spent at home, but you're not really home, you're doing work, right? Or there's a lot of conflict and scheduling, a conflict and just workability, right? When we talk about the work-home issues when it comes to being a physician, right? So the parents also are much more likely to, experience that burnout than others. Next, and I thought this was funny, right? If your spouse or partner is a non-physician, right? And this, like, again, if you've read my blog, dating a medical student, right? Like, one of the key things I said is that when you're a physician, right? When you're a medical student, right? All you think about is the medicine, right? All you think about is, how can I get to that next step, right? But if you're with someone who really ain't in that same mindset, right? Like if you're someone who didn't go to medical school or one of these like really schools that cause you to be like almost like have to be in love with your school and like almost ignore everything else, right? You're gonna get a lot of pushback, right? Because they're just not gonna be able to understand, unfortunately, like all the stuff you got going on, and why you got to dedicate so much time to this case over here, right? Why do you got to do your like? They're not gonna really necessarily understand that. So those who have a spouse or partner who isn't a physician also are more likely to experience burnout, right? Which again, I thought it was very interesting, just kind of reading the articles from that standpoint there. Now, of course, with my Lunch and Learn community, you know that I always try to look for the ethnic and racial, backgrounds and how are we affected, right? Especially in the African American community. And right now, from a physician standpoint, there isn't many studies that point to a fundamental difference between who's burnt out more. But they did look at medical students, which I thought was again another interesting caveat in the presentation. They looked at medical students and showed that medical students had a prevalence of burnout lower in the African American community than those in the Caucasian community, right? And I got my theories, right? I got my theories on it of why African Americans are probably less likely to say, you know what, I'm done. Like, I can't do this more. I'm not going to do this when they're a medical student versus the Caucasian, contingent, right? And I think a lot of that just deals with the fact that I think, again, I hate to say majority, right? But let's say a good amount are saying, you know what, like I've been through a lot more stress than this. So you know what, if this is just an added bit of stress, I'm here for it, right? Where I don't think our Caucasian contingent experiences that much stress leading up to medical school, right? So I think that plays a big factor. Again, I don't know. I'm just kind of hypothesizing why I think that is the case in that regards, right? So again, and I want to tell you, right? Like I wish I was like just reading this on an article and saying, oh, you know what, this is a good theory, right? But let me tell you, right? I'm in Facebook groups right now, right? Multiple Facebook groups with physicians who are trying to get out that relationship, right? I'm in multiple Facebook groups where physicians are like planning their exit up out of there, right? So again, I'm telling you, this isn't like something that Dr. Pierre is just kind of like he thinks about, or just his close circle is kind of hypothesizing. No. There's a lot of physicians out here who can't wait to jump out and do something outside of medicine, right? Who can't wait to jump out and kind of branch off, right? And again, let's turn the camera on myself, right? One of the reasons why I started, Dr. Barry, Dr. Pierre blog, and all these things there is because I wanted like a different outlet to kind of express myself, because I realized that traditional outlet of being a physician just wasn't going to be for me, right? So that's why I do the blog, that's why I do the video, that's why we're doing the podcast, right? Because I just felt like I didn't want to be confined to what that traditional physician does, right? And I think having these outlets to talk to you guys, to talk to you directly, and try to affect change directly and serve you guys directly has been a big help for me, right? So I think that's why a person like me necessarily isn't affected by burnout, but I could definitely understand why a lot of my colleagues are in that regards, right? So I think, what can you do, right? Like you've listened to this, right? You got to the end, right? And you said, man, like Dr. Barry's telling the truth. Like I need to go talk to my primary like right now and just say, hey, please don't leave me, right? Like what can you do, right? And honestly, for a lot of them, there's really not much you can say, right? Because for a lot of them, depending on where they're at in their career, where they're at in their mental health capacity, right? A lot of them are probably already gone and plotting, right? Like I said, again, I wish I could lie and say that, what, those groups that I'm in that have physicians who are plotting their way out are like 100, 150, but like they're in like the tens of thousands, right? Like there's a lot of physicians out here who are boop, 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 like plotting the door to head up out of there, right? And that's something that I really need y'all to kind of get, right? So again, the next time you see your doctor, right? Next time you see your internist, your family man physician, your pediatrician, your surgeon, your cardio, whoever you see, right? The next time you see that, right? Next time you run into your nurse, right? Or you run into the nurse of a person who's taking care of your family member, right? Just say thank you, right? Say thank you for doing what you do. Thank you, and let them know how much you appreciate their work, right? Because if and I can tell you that's gonna make a difference. I can tell you that's gonna change their day. Like if they were sad that day and they hear someone say, "Hey, you know what, Doctor So and So, hey, Nurse So and So, I love the fact that you are taking care of me. I love the fact you're taking care of my family member, and I appreciate all the hard work that you do." You will make their day, and they'll be talking about you for at least a week, right? Because honestly, it don't happen that often, right? Especially again, I may be skewed, right? Because I'm in the inpatient world now, where a lot of people ain't happy to be in the hospital, right? And they really not very lovey-dovey with the person who gets them like from the ER room and outside the hospital, right? They don't really get lovey-dovey with that. Outpatient world is a little bit different, right? They used to love me in the outpatient world. Inpatient world, they don't love me as much. I guess I'm not sure what I'm doing out there. But again, I want y'all to think about it, just, and also work with your physicians, right? Again, if your physician wants you to take a medication, you need to be taking that medication. Please take that medication, right? Again, quick side caveat, I got a patient I'm taking care of right now in the hospital who had a stroke, right? And why did this patient have a stroke? Because they did not take blood pressure medication that the doctor told them to do. They said, I didn't feel anything, so I didn't want to take it, right? And I wish I could tell you that this person is telling me that, but the stroke was so massive they can't say anything, right? So I want you to think about that, right? Like just follow the directions that your doctor is trying to get you to do, right? To be healthier, right? Like that's all I want you to do. You want to look out for your physician, right? You want to say thank you for your physician. Just do that, right? Just be compliant on your medication. Be compliant with your treatment, and it'll go a long way. And so for that, I say, I apologize that I had to break the news to you, but your physician is cheating on you, right? And for some of you, your physician may not leave today, they may not leave tomorrow, but they may already be on their way, right? And that's okay, right? Just understand it's not you, right? It's them, right? It's not you, it's the system, right? You're okay, but the system has unfortunately failed them, and that's why they gotta leave. Stay tuned next week for another great episode, and remember, empower yourself for better health. Thank you for listening to another episode of the Lunch and Learn with Dr. Barry. Please head over to lunchlearnpod.com where you'll get the most recent episodes as well as today's show notes for your listening and viewing pleasure. And like always, depending on where you're listening this to, please subscribe to the podcast so you can get all the latest episodes sent directly to you. And we are at all of your favorite podcast listening stations, including Apple Podcasts, Google Play, SoundCloud, iHeartRadio, Spotify, and Stitcher Radio. Again, thank you for taking the time to listen and empower yourself to take control of your health, and we'll see you next week.